research methods that will accompany you throughout the next few months and take you into the summer. You'll have maybe about one topic every 3 to 4 weeks over the next few months. And then during the summer experience, a couple of hours a week where we're offering basic lectures and interactive discussions about different approaches to research. And I'd like to introduce Karina Musharrao, who is my very close friend and colleague, and we do a lot of research together. She's at the Fielding School of Public Health, and she's actually designing and gonna teach this course for you. And this is sort of the first in the series to talk about the IRB, and I'm going to let Karina share a little bit more about what she's putting together for you. It's not finalized, but she can give you the preliminary. And we really hope by the end of the summer, you come away with some basic foundations and maybe some thoughts about how in the future you might want to focus in a particular research area or methodology. So, and then we'll also, after Karina, have everyone just do a quick introduction, ending with Tom and Paul, who are going to lead the session.
Great, thanks, Risa. It's nice to meet you all over Zoom. So as Risa mentioned, I'm faculty in the Fielding School of Public Health. I am a global health systems and health services researcher. So I will be with you all virtually for the next few months. This is the first time that we're kind of doing this sort of series on research methods as a process throughout your STTP experience. So be patient with us. It's a learning experience on both sides. I say that also because the topics that we will be covering, each themselves could constitute one, if not more than one, entire courses. So we will be barely scratching the surface on some of these research methods. I am always happy to talk more about them. We'll be giving you resources if you want to or need to go into more detail on them, but we will be covering everything from sort of overview of different study designs and what sorts of questions and causal inference those different designs can help you answer, to instrument development, both quantitative and qualitative, overview of methods, both quantitative and qualitative, analysis, both qualitative and quantitative, systematic reviews and literature reviews. We'll have guests come when their specific expertise is relevant. So for example, Dr. Coates today, who will be speaking to you about IRB, will do a much better and more thorough job than I would be able to, given his expertise. So we'll be bringing people in to complement sort of the sessions that I'll be leading. We are working on the final list of topics, dates, resources, learning objectives now, and we'll be doing these as 1-hour sessions. So, I'll keep saying this throughout, but I would encourage you to reach out to me and sort of continue the conversation outside of these Zoom calls, because there's no way we can sort of cover enough detail. And due to the breadth of all of your projects, that's part of why the list of topics is so wide. And so you'll have specific needs, and you should feel free to reach out to us. So I will leave it there, and I'll actually toss the ball to Rachel, because she's been working on some of the sort of coordination pieces, and she may have things to add directly to what I just said. So Rachel.
Great, thanks, Karina. So hi, I'm Rachel Abbott. I don't know many of you. I'm the program coordinator for the Global Health Program. Great to see everyone today. Thanks so much for joining. So yeah, I've been working closely with Karina to plan this series for you all this spring and summer, and we're really excited. Like she said, this is our first attempt at doing something like this, so we'll be really looking to your attendance and feedback to help guide us and teach us for future years. But it's going to be, something really special, and I think we'll all be very fortunate to go through this series over the next several months. So you'll be hearing from me a lot in the coming months. You can feel free to reach out to me with any questions about IRB or about the upcoming schedule, and we'll send more information your way later this week. So just be on the lookout for that. And Trace, do you want to quickly read?
So hi, everybody, and I just wanted to congratulate all of the students on making it through the Block 3 exams. I hear they can be tough, so congratulations on finishing that step. And I also wanted to, so everybody knows me, the Director of Education with the Global Health Program. I have met with all of you at this point. I did want to make one follow-up comment though about Dr. Mushro being involved with teaching these research methods. She's the perfect person to be doing this because she has mentored quite a few of our students that have participated in these very fast-moving summer research projects. She knows kind of in general what you guys have, what you're lacking. Obviously, there's a whole range of skills. You guys all come to this program with very different backgrounds, but over the years, she's kind of seen where people could use a little boost. And so we are incredibly fortunate for that reason to have her in this role, because it's not just somebody on the outside who's never had any experience working with medical students and what they bring to the table. So thank you all for being here. I'm going to pass it to Vegeta, who you all know as well, I think, but let her introduce herself.
Hi, I'm Vegeta. Most of you have gotten lots of emails from me during the selective, and for those that haven't, you've received emails from me about planning these work in progress. And Tucker, of course, we've had very long history for the past couple of months, but it's nice to meet you guys again. And if you need anything, please feel free to email me as well. And if Rachel can't help, I'm more than happy to help too.
Great. So let's jump in and have each of the students just do a quick introduction, your name and like a one-liner if you can describe your project in one line. If you need 2 lines, we'll give you that. And I'm just going to call you guys out in the order I see you on the screen. So Avra.
Hello, everybody. My name is Tucker. It's nice to meet all of you. I'm working with Dr. Tyra to do a language access project, improving language access at all of you, or language translation services.
Sorry, Shiv. Sorry, Tucker. I called you Avra because that's what I can see on my screen.
Hi, everyone. I'm Shiv. I'm actually working with Dr. Joseph Daniels at Drew, doing a project in South Africa. We're looking at like HIV prevention and treatment through the implementation of this new interpersonal relationship intervention.
And Christine.
Hi everyone, I'm Christine. I'm working with Dr. Korean Nielsen, and we're looking at COVID-19 in pregnant mothers and seeing how that inflammatory environment can impact the neurodevelopment of the child.
And Anjali.
Hi everyone, my name is Anjali. I'll be working with Dr. Karachezi, who's Rwanda's first and only female neurosurgeon, as well as Dr. Yang. And we'll be looking at barriers to neurosurgical care in Rwanda.
And Emily.
Hi everyone, my name's Emily. I'm working with Dr. Buck and looking at like inpatient nutritional outcomes among pediatric patients who have acute malnutrition in Mozambique.
And Daniel.
Hi everyone, my name is Daniel. I'm also working with Dr. Tyra to do qualitative interviews to identify obstacles to people using translator services in the emergency department.
Great. Michaela.
Yes, hi everyone. I will be working with Dr. Dicker and Dr. Juilliard, looking into the epidemiology of obstetric and gynecological injuries at a rural hospital in Uganda.
And Kendra.
Hi everyone, my name is Kendra. I'll also be working with Dr. Brina Taira, conducting qualitative interviews on the development of a guide to facilitate emergency medicine as a specialty in Latin American countries.
And last but not least, Joy.
Hello, good afternoon. My name is Joy. I'll be working with Dr. Christopher Tarnay, and we will be doing a project on program implementation and looking at remote education and of like surgical gynecological procedures in Uganda.
Great. Did I miss anyone? No. Okay, great. And just one more thing I forgot to say in the beginning. The other thing we're looking to do for you all is to actually invite guest speakers from our global partnerships and have you hear from them about their own research. So just to give you a flavor for, different collaborations and different types of research that's going on. So excited for that to be introduced as well. So I'm going to turn it over to Tom to launch us into the discussion.
So let me introduce myself, and then I'll ask Paul and Moore to introduce themselves too, as well. I'm Tom Coates. I've been at UCLA for 18 years. Before that, I was at UCSF for 21 years. And my research is focused on HIV prevention and treatment access for the last 30 years in Sub-Saharan Africa, South Africa, and Malawi. And I also direct the University of California Global Health Institute, which is a system-wide global health institute. And I chair the South General IRB, where most of your protocols will be reviewed. So, and great to meet you and also hear about the incredible variety and interesting topics that you're going to be working on with the STTP program. It's very interesting. Paul?
Hi, everyone. I'm Paul Lillig. I am the administrator for the general IRBs here at UCLA. One of those IRBs, including the South General IRB. It's a pleasure to meet everyone. I've worked at the IRB office for about 18 years now. So happy to help with any of.
You're not old enough.
I started at the IRB when I was actually 18 as a student. So it's literally half my life now. So it's a pleasure to meet everyone, and happy to help with any questions along the way before and during and after your submission of IRB protocols.
Thanks. Moore?
Hi, my name is Moore Reese. I am the Assistant Director for Education and Quality Improvement in the Office of the Human Research Protection Program. So I'm here as a backup to Paul and Dr. Coates to find out if you have like specific needs or specific training. My unit might be able to come help your group with that. So I'm here as a backup.
So my understanding is that you all, you looked at a recording, is that right? Or not? Did you look at the recording?
We sent around, I think, the recording to the last presentation that you did, Tom.
Right. So people may or may not have looked at it.
Right, depending on where they are in the process, may or may not have reviewed it closely.
So I didn't come prepared with any kind of a presentation, more Q&A. So it was that was my understanding. So I think if we, is that right?
Yeah, so just a reminder to everyone, Tom actually gave a presentation about the IRB submission process. When was it? Last fall, and we have it recorded, and we'll again send the link to that YouTube recording after this. Depending on whether you've started with your IRB, you may or may not have had the time to look at that, but this is really an opportunity to ask Tom, Paul, and more questions about where you are, and at the very least we can go back around and get updates on where you all are. And then the recording is something that you can watch in your own time, where Tom gives a bit more history and background on the IRB process.
I strongly recommend the recording. It's probably one of the best YouTube recordings you'll ever see. It's really good. I think the strongest piece of advice that I have is not to be intimidated by the IRB process. That's the first sort of piece of information. I think also most of the work, probably all of the work that you're going to be proposing to do will probably fall into an expedited category, or maybe even an exempt category. So the review process can be relatively rapid. And we'll talk in a minute about what constitutes expedited versus full board versus exempt processes. The third thing that I really want to recommend is to be very, the IRB submission process leads you through pretty carefully everything that you need to answer. Where it gets challenging is if it's not complete, if it's not consistent, and especially if there are inconsistencies between one part and the other. So when you get ready to do it, be sure that you have all the information that you need, that you go through fairly carefully and make sure all the information is there and that it's fairly complete. What will then happen once your faculty mentor signs off on it is that it will go to a staff member to review. They will find everything that's wrong with it. You know, sort of all of the inconsistencies, all of the details. And it's the kind of thing where the detail matters, because essentially what the IRB process does is it says that the institution is allowing you to conduct research on human subjects. And that's very important because it indemnifies you. As long as you follow the protocol, it indemnifies you against any allegations of wrongdoing. And so it's really a contract between you and the university about what you're going to do as you interact with human subjects. Of course, as all of you know, the need for human subjects review has a long, long history, you know, culminating, you know, including some really terrible experiments on human beings, like the Tuskegee syphilis experiment, the experiments that the Nazis performed on members of concentration camps, and on and on and on and on, the syphilis studies that the US supported in Guatemala. So there's a whole history of really research that really violates human subjects. And so the principles and the practices have developed, I think, to a sophisticated point. They're always evolving further, but it's required that any research done at any institution where there's federal support needs human subjects review. And any research that any institution does with human subjects requires IRB approval. Paul or Moore, is there anything you'd like to add to what I've said?
That was a brilliant summary of why we do what we do.
That's why I like you so much, Moore. You're so great. Yeah.
People generally have more like more sort of specific questions, like what's the turnaround time for an expedited application? I've noticed in my trainings, and I think Dr. Coates really hit on some important parts of that. Is that don't be scared of us, and if you get a request for more information, that's often where people sit on it and they're like scared to respond. They don't know how to respond. Everyone in our office, whoever you get assigned to shepherd you through the process, and our staff, could be Paul, could be someone on his team. We're all trained and really excited to help you get your study approved. So pick up the phone, give us a call, send us a message, whatever you're most comfortable doing, but don't let it just sort of sit there, and don't let the stress about it mount as it sits in your inbox waiting for something to happen.
Yeah, I think that's important, Moore. Our modus operandi is pathway to yes. We want to get you approved. We want to get you to do your research, but we want to be sure you do it in accordance with the rules and regulations. Paul?
Right, and I just want to make sure that everybody does understand that there's really is an expectation that there'll be an approval, immediate approval of initial application. I think in my 10 years of being an administrator for one of the IRBs, we've only had one or a handful of approvals that are straight approved without any questions from the IRB. So you can expect that there'll be some sort of questions about clarifications, or maybe not necessarily anything dealing with risk, but just making sure that your applications are in good enough shape to have it approved. So if there are reviews in the future, if there's changes that you make to your protocol in the future, the IRB can adequately assess going forward, and more so recall what's already been approved, so that there's sort of a clear line from beginning to end of your research.
So just curious, maybe we can have people, the students raise a hand, either your hand or the virtual hand, as to whether or not you've ever submitted an IRB application before. So a couple. And is anyone already working on a UCLA IRB for the project you're doing this summer? So not yet, no.
Now would be a really great time to start for a project you're going to do in the summer, because if there are questions, if the IRB like needs you to sort of get some local context information from your collaborators in another country, like that can take some time. So we recommend you start soon.
And I don't know if it might be useful. I think one of the challenges with this summer experience is that most students are either using existing data, collaborating on projects that are already approved. So maybe they just need to be added to the application. Like for Christine, for example, I'm guessing that's the case with Dr. Karen Nelson. And then some of the projects, like I recall Joy's, who she can chime in, is, you know, she's going to see data from people who are filling out, she's going to see anonymized data from people, I believe it's in Uganda, who are evaluating or doing pre-post work with an education course. And Joy, please jump in if I didn't summarize that correctly. Okay, so you know, I think the distinction between, you know, especially for the students who are looking at anonymized data, what is the approach you suggest? Are those non-human subjects they still should go through, but will likely get a non-human subjects designation, or are those, you know, expedited? And, you know, just to maybe talk through some of these different examples.
I could speak to that. So if you are doing a secondary analysis for your own research purposes, that should be submitted to the IRB as your own IRB application. So you shouldn't be added to maybe another faculty member's IRB protocol. Make sure that it is your own. Even if your research is determined to not be human subjects because the data that you're analyzing is de-identified, we still want you to come through the Web IRB application to get that determination. So our application will branch you to the necessary sections wherein you could either submit to the IRB for the designation of non-human subjects, or you can print and sort of record for yourself the determination. Though our recommendation is that you do submit to get the determination from the IRB office.
And most of those protocols will be exempt because it's anonymized data. It's not human subject research. Human subject research involves identifiable human subjects.
So yeah, so I think the take-home message for most of you then is that you'll create an application, and you know, as you enter in the correct information, it's going to lead you through the IRB system is very smart. So as you click one answer, it's assessing what your next set of questions needs to be. So you know, and you can get into the system and play with it in a way that you don't actually submit it. So you could actually play around with what happens if I click, you know, yes to identifiers, what comes up versus no. And I think that just to learn the different way the IRB system works and what you might need in different types of research is sort of, you know, an interesting learning activity in and of itself. But, you know, for the time frame for these types of applications, still we should start now, but can you guys comment on how much time these types of applications take?
So we do have actual general statistics on our website, but more broadly, it depends basically on level of review, sort of turnaround times based off of staff's ability to triage to a reviewer, your time in which it takes to respond to our requests. So there can be sort of a large amount of time that can be from beginning to end. However, for determinations that are solely for data, in which you're requesting basically a non-human subjects research determination, those are usually handled within several business days. For our exempt review, and exempt being a category review, which you're submitting a full IRB application to the IRB office, you're just meeting specific criteria for an exemption review. That category is generally reviewed within 1 to 3 business weeks. But like I said, there's give and take. It might be sooner, it might take longer. The expedite review process is generally 1 to 3 or 2 to 4 weeks. And our full board level of review can be anywhere between 3 to 6 weeks, sooner or longer, again, depending on any other issues that might come up.
Risa and Rachel, how long did your recent protocol take?
I don't know if you want us to talk about that one. That was
longer than we would have liked.
Yeah, I mean, that's Tom's bringing this up because we submitted something that we felt was supposed to be pretty simple. to look at anonymized data in Malawi, and we got caught up in different loops with the IRB, and I think it took like 6 weeks when we thought it would take a couple. And that's anonymized data with IRB approval from Malawi already granted. So that's why I think we're really encouraging you all to start now, because sometimes it's mistakes that we made. You know, we just clicked the wrong button. That happened frequently. And even though I've done a lot of IRB applications, I'm still learning the process. So I see a question in the chat, so I'm gonna read this. This is from Kendra. So how many IRBs needs to be submitted? Mentor from all of you is submitting. Are you supposed to submit a separate one? So let's have the IRB. So this is a faculty member who's primarily has an all of you. Does all of you have their own IRB, or did they use the UCLA IRB?
All of you has their own IRB.
Yeah.
Okay. So she wants to know, does she submit a separate UCLA IRB?
That would actually be a question to send to our IRB Reliance team, because I'm actually sort of out of the loop on the Reliance process. So I recommend sending email to IRB Reliance at research.ucla.edu to ask the specific question.
So the NIH has implemented, particularly for NIH supported research, what's called Reliance. So I once did a project that I think involved like 20 different IRBs, and they all had to approve it. And then somebody would want something changed, and it was a mess. So the Reliance means that one IRB can be the IRB of record, and the other IRBs can rely on that IRB's review. So there's one faculty member now who has a multi-site study at 4 different medical centers around the country, and they're all relying on the UCLA IRB. So I think that's an important innovation. So if you're going to be doing something at all of you, and there is an IRB approval from all of you, can you just submit a Reliance request? And I think Paul's recommendation there is write to the Reliance team and ask them.
The other thing is to go back to Paul's earlier guidance, that if you are doing if you have a new specific aim, you're doing a new secondary analysis of data from that original project's scheme, you should probably submit your own application, because Reliance is generally for like the same study happening at multiple sites, and that might not really fit into this particular construct. But if you've got a new specific aim, if you're asking a new question, you should submit it as your own project, and you can describe the fact that the data you're getting is de-identified from all of you and all that kind of stuff, and that project has approval there, and all that information can be considered and put into it. So it may or may not be the kind of study you do as a Reliance, depending on if the same thing is happening at UCLA and at another site, generally speaking.
But for Kendra, it's still actually an IRB submission to UCLA to rely on the all of you IRB. So there's still a step that needs to be taken, yeah. But it's faster.
It's very confusing because all of you has UCLA in its title. So people think it's part of us, but it's not part of us from an IRB perspective.
Thank you for the explanations. That was very helpful.
Great, and I just wanted to jump in also real quick. If people haven't gotten started, just a reminder to first take a look at the city trainings, and I'll resend that, IRB primer that we also sent out with your acceptances that kind of outlines exactly how to use that website and which courses we recommend. Those are really helpful. They don't take a lot of time at all, so don't be nervous about that, but they will help get you started. And likely if you don't complete them, well, some are required, but also if you don't complete them, those will be the mistakes that will turn up in your application. So really recommend that you take a look at those as a first step. And actually the first step before that, which is also in the primer, is to make sure your mentor helps you create an account. So that's just another nudge. If you haven't done that yet, then that's why we scheduled this session, this first week of March, so that we can make sure to remind you to get going on those initial steps.
So I think it'd be good, Rachel, to send another email to the group just with those two things. So how to request, what the mentor needs to do to request them to have access, because it's sometimes faculty forget, and it's just easier if the students can email the mentor and say, can you email this email with this information so I can have access to the IRB? And then the city training is required if you're going to be listed as an investigator on this application. So you won't be able to get your approval without the city training. You actually get certificates and you have to upload your certificates. So that's another important step, and Rachel can send the link to city training and list the courses that are required versus optional.
Right, and the city training, I'm sorry.
I was going to say, our city training got simpler and shorter recently. So congratulations, you guys are in the bonus group. So there's only one human subjects course. You can sort of say no to all the other things you go through in the branching logic. But for human subjects training, you just need to pick any 8 modules for initial certification. So you can pick, and we hope that you would pick the training that is most relevant to your research. Pick international research, pick research with non-English speaking populations. Like, there are modules really specific to those different aspects of research. So congratulations.
That's actually really great news, because that definitely was, there was a lot of confusion around it too. So
We tried to make it less confusing. I'm not sure if we succeeded, but you can give us feedback if it's better or worse.
So Joy's asking if they did one at the beginning of medical school. I think it's definitely not something I think that's required as part of the curriculum. It's different than HIPAA training and some of the other trainings you've done. So I'm pretty sure you wouldn't have just done it routinely as part of your curriculum.
So, and that brings up a great issue, is that if you're going to be working with PHI for your research, you'll need to do the research HIPAA training, which is also through City. It's separate from the clinical HIPAA training that you have to do for the UCLA Health. So just as a reminder, there's that piece of it too, if that's relevant to you.
Can you tell us what CHI is?
CITI?
No, CHI. Didn't you say CHI?
No, PHI.
PHI. Can you tell us what PHI is?
Yes. Protected health information. So if you're going into the medical records of an institution that has an electronic medical records system in the United States, it'll fall under HIPAA regulations. HIPAA regulations are adjudicated by the Office of Civil Rights in Health and Human Services. So it's a separate set of regulations that are about privacy of medical records. And it wasn't actually designed for research purposes. It was designed so that you could take your electronic medical records from one provider and they could carry over to the next provider, and you would have rights and autonomy over who got to see them. So it's a little bit of a square peg in a round hole for research, but we have specific training just for that purpose. So if you're going to be using medical records for research, if you're going to be accessing protected health information, then you should do the research HIPAA training in City program.
And then Tracy's raising a question. I think the answer is yes. Is City training required if the research is with anonymous data and ends up exempt?
The human subjects training is required, but if you're not accessing PHI, or protected health information, which is it includes one of 18 identifiers. So if you're saying it's anonymized, it wouldn't have PHI. So you wouldn't have to do the research HIPAA training, but you would have to do the human subjects training, even if we inevitably make an exempt determination on your research. But again, you only have to do 8 modules, which is less than you used to do a month ago. So, and you don't have to do them all at one sitting. You can just do them a little at a time as a break from your binge watching of whatever great show you're watching these days.
So the reason I asked that question is because now I have been associated with 3 different projects that have all been exempt, and I've never had to upload or show anything. And so that's why I'm a little confused on whether it's required or not.
So the uploading isn't necessary if you log in and do your City training, and if you log into City program with your SSO. Our system syncs with City every night. And so it'll show up in our system that you've gotten the training. So you actually don't need to upload it if you do the single login, which we highly recommend. It makes our lives a lot easier, makes your life easier. There's no upload, it's great.
I was also just going to take this opportunity to underscore something that was said earlier, which is that only the IRB can make the determination as to whether your research is exempt. So even though there's a nice little checklist and you can look at it and it might give you an idea as to whether your research will be exempt, you still have to go through the process, and the IRB is the one that makes that determination. So just a little moment to like reflag that. You know, it'll be much quicker probably than going through an expedited review, et cetera, but only the IRB can make that determination. You still have to go through the process of submitting creating an account and submitting a protocol, et cetera, et cetera.
And then Christine was just asking if city training and IRB, does a city training account have to be sent and linked to the PI for IRB approval? So it's one set of city trainings. It's good for all the access. It does expire, so you do have to renew it, but I think it's like a couple years that it's good for usually.
3 years.
Okay.
Yeah. And the HIPAA never expires. You just take that once, and so you're good, at least at UCLA. The tricky part is if you did city program training at another institution, now that we have any 8 modules, you're very likely to get credit if you recently did it at another institution, and they'll transfer over. And what you'll need to do is log into your existing city program account, affiliate with UCLA, so add UCLA as an institution to your account, then get out, log in through your single sign-on, and then you'll get credit, and you'll see that like modules completed, and you'll get a credit for the human subjects course that you want to get credit for here.
Does anyone want to ask questions about their specific situation or project? I think even if your project's very unique, it may be helpful to others who have, something similar that they may be facing.
Yeah, I have a question. So my project it's like part of a larger grant that Dr. Daniels is working on. And the study like just got approved by NIH. So it's like the first phase of data collection. Like they haven't even begun data collection. So my project is kind of setting up models of data collection / like a lot of it will be like literature review. And so I won't be working with human subjects. I did resubmit like to the UCLA IRB because the Drew IRB, I had to like do that. But that's why I'm wondering like whether I'll have to do the city training because there's no working with like secondary data or even anonymous data.
Yeah, and I actually think, and Tom and Paul, you can chime in, but like it's basically literature review. So when we were reviewing the applications, my feeling was like you were the one person that probably you don't need IRB because you're basically doing literature review. But let's hear from the experts.
Right, the literature review it does not require the IRB review, and you're not required to do city. I mean, we recommend that everyone does city so they're aware of the history of the IRB and what we're considering, but we wouldn't make it a requirement that you do the city training.
And then also, Shiv, if you're going to be involved with this project long term, and you may, be added as formally as an investigator in data collection phases and want to be part of it, then having done city training would allow you to easily take that next step. So I think it's good for multiple reasons. At some point, usually it comes up, and this might be a nice time to tackle it. It's really not that much time, and it's interesting and helpful.
Okay, yeah, that's helpful. That was gonna be my next question because I'll probably stay on even after the summer. So, okay, I'll probably just get it done.
Could I ask another question about reliance again, if that's okay? So my mentor was saying that she intended to do it through All of You IRB. And I know we had just talked about this, but my understanding is that all of the study conduct would only be at All of You. Like there's not going to be anything at UCLA. I know when I previously worked as a research coordinator at UCLA, the only time I filed reliances was when like study conduct was actually taking place at like UCLA, like in Westwood. So I guess I just wanted to clarify, do I still need to like file a reliance if all of the conduct is only going to be at All of You?
You want me to take that more?
Go ahead.
Okay. So the reviewing IRB is the IRB of whom the person that is running the research that's primarily responsible for the research is doing the research. So if this is your study and it's intended for your specific aims, then it should be submitted to the UCL IRB because we're your reviewing IRB. So anything that happens under the umbrella of that, if you have a collaborator that's working at another institution, then we could discuss potential for reliance, but we're responsible for the review of your study.
Okay, that makes a lot more sense now. Thank you.
Can I ask a follow-up question to that that will be relevant when he goes to submit? So when he goes to submit, should he be submitting saying like, I'll be receiving anonymized transcripts from this other project, or does he submit for the project? Do you know what I mean? Does he submit for like collecting the data, or does he just submit for, I'll be receiving these data, I'm going to be analyzing them?
Right, great question. You're submitting for what you're doing. So your project is a secondary analysis of the data that's being collected by another researcher for a different purpose. So our scope is limited to what you're doing for your research.
But it is very helpful to know where the information comes from that you're going to be analyzing. Do tell us that part.
I mean, the other piece that we're not focused on, because we are focused obviously on the UCLA IRB, is that for those of you that are doing projects outside of all of you and in other countries, that each country has its own process for getting approval for studies, and it's really equally as important that those processes are being followed. We've asked your mentor and PI to be directly responsible for making sure that those applications are submitted, approved, updated. But I think it's good for your learning and knowledge to definitely have a sense of what is going on at the in-country level. And in some cases, the IRB would require you to upload the IRB approval from X country to verify that the activity is IRB approved. And, I think there are different circumstances that, I think if we want to, go ahead and help you on a one-on-one basis. And again, just bringing up Joy's project, because it's sort of like an education project. And, I think there's a little bit of confusion around whether the local authorities would think that would require, ethical approval and what sort of approvals are required. But we really want to be mindful about those in-country processes as well.
Right, and please let us know when your application is submitted, what the discussion has been with whatever institution it is that you may be working with in the country you're working in, to let us know what their requirements are. So upfront, we could determine our requirements.
Any other questions?
Again, just to repeat something earlier that was said earlier, I mean, if you do have questions, just email, shoot an email to Paul or me or Moore, and we'll do our best to answer your questions.
And Rachel's also, if you're feeling shy about whether this is a question for the IRB, you can also reach out to Rachel, who's had a lot of IRB experience, and she can help you decide, what your next step is if you're not sure. But as you can see, the IRB is very friendly, and so you should feel very comfortable taking your issues to them. But if you would like to filter through us, Rachel would be your point person for that. So, I mean, I think if everyone's kind of feeling comfortable, we can end early and people can have a bathroom break and get some food before their next Zoom. But I think in terms of action items, Rachel's going to send around the specific information your mentor needs to give you access to Web IRB, and also the link to city training, which maybe, I'm not sure if we might need to connect with more to help clarify the way the new training works, so that we can be very clear in our instructions. We can follow up with you offline for that. And then, we're here for you to help you think through this process and start looking into your city training once you get the links from us. And, you know, please do start now talking to your mentor and thinking about getting going, because this can be a lengthy process, even for simple things. So we want to make sure you're good to hit the ground running for your summer.
So I'm going to just put a link in chat. It's all about the city training. It's been updated since we updated the process. And it also tells you how to link it to your single sign-on and how to link to UCLA if you have an existing account. So all of that is on this one page. So hopefully it'll be one stop shop.
And our office homepage has a getting started section that does outline sort of the procedures for obtaining the WebIRB account, our links to our consent templates, links to explain or give guidance on recruitment. So I'll send that link over as well. And Rachel, I created a little sort of how-to for our students that submit, because the submission process in WebIRB is a little different for students than it is for sort of our standard faculty PIs, wherein after you create an application, you don't submit directly to our office. You actually submit to you send your application to your faculty advisor first, and your faculty advisor has to provide assurances prior to the submission. So I'll send over a document that can be shared that sort of explains that in a little bit more visual detail.
Great. Thank you for that.
All right, and so stay tuned for lots of emails from Rachel and Vegeta for scheduling, and we're really looking forward to supporting you all and seeing what exciting work you're going to do, and doing our best to really give you a flavor for some of the global health too that you're experiencing from Zoom on the ground here in LA. So we'll look forward to more to come. Thank you, everybody.
Thanks, everyone.
Thank you. See you in a few weeks.
Bye.
Bye.
Thanks.